Welcome back to another episode of Spilling the Tea with Dr. T
And Gabriel G.
and your favorite, Lava Lee.
Welcome back to another episode. As usual, really excited to be able to meet with you all to discuss another health-related topic. And today we're going to talk about something that I get a lot in the office, and definitely a very common issue that men experience, which is male pattern hair loss.
Even I had multiple questions in the last
Yeah.
few years about hair loss.
Yeah, I think, it really hits home for a lot of us. I have been in periods of my life where I frantically am checking the
Yeah.
mirror to see if hair is moving or changing. I know you've experienced that yourself. And so I think a lot of us can relate with the concern, is this hair loss? What's happening? How do I fix it? Or maybe it's just normal. So gonna be excited to go through a lot of these questions and hopefully provide some helpful information to people out there. In our traditional style, we're gonna make it as laid back and low key as possible, with still being able to, target and highlight that important health information. So excited to get started.
Yeah, I'm excited for the questions to be answered, excited for the knowledge to be learned. And yeah, once again, we're here to provide information and health education to you.
Absolutely. Absolutely. Couldn't have said it better myself. So let's dive in,
Let's dive in. First, let's start with the basics, as always.
as always.
What is exactly male pattern baldness?
So, male pattern hair loss or male pattern baldness, also known as androgenic alopecia, is a very common form of hair loss typically seen in males, and it has a characteristic pattern. So, typically, you're going to see a receding hairline, and you're going to see thinning and even maybe a bald spot at the crown of the head. So, this is very specific, as there's many different types of ways that baldness or hair loss can present. So, if you're seeing that receding hairline or a bald spot presenting sort of at the crown of the head, that can be characteristic of male pattern hair loss or baldness.
Interesting.
Yeah.
And how common is male pattern hair loss?
Yeah, so around 50 million men in the United States currently have male pattern hair loss that has been diagnosed, but as you can imagine, many men don't get diagnosed specifically or officially. But studies have shown in general about half of men by the time they reach age 50 will have signs or symptoms of male pattern hair loss.
Wow, that's crazy.
Yeah, so really common. Certainly a reason why so many patients ask me about it or present with concerns about it. But the good news is there are some things we can do about it, which we'll get into later.
It's reversible,
It can be.
like many things we learn here in this channel. So, what are the causes for male pattern baldness?
Yeah, it's a great question. So we want to look specifically at some various factors that can be contributing. So there's genetic issues at play here, hormonal issues, lifestyle factors can be important as well. But we know what is the most impactful are going to be those two, genetic and hormonal. So our genes are going to make us susceptible to something called dihydrotestosterone, which is a hormone. So dihydrotestosterone, or DHT, is converted from our testosterone through an enzyme called alpha 5 reductase. And I know this is a lot of medical jargon, but we're going to get specific for this particular part of the discussion. So dihydrotestosterone, converted from testosterone by that fancy enzyme alpha 5 reductase, is going to create issues at the base of the hair follicle. So some people genetically are sensitive to DHT. When it arrives at the hair follicle, it can cause the hair to become inflamed and irritated, specifically at the base. And so what we see is DHT over time will cause that hair follicle to prematurely age and grow. And so it starts to, over time, get thinner and then shorter, into where it no longer produces a hair follicle completely. And so we know, of course, genes are at play here as well, because some people can have very high DHT and completely keep all of their hair, while others can have medium to low DHT but be sensitive to it enough to where it results in baldness. And we'll get into more details about that, of course, later. But the primary culprit in regards to the cause of male pattern hair loss is going to be DHT, or dihydrotestosterone.
Wow.
Interesting, right?
It's always testosterone somehow is connected to the problems we have, or
Yes. And of course, there's a hormonal balance there. So typically patients that have male pattern hair loss are going to have high DHT, because that enzyme is converting all of their testosterone over. And so there's no testosterone left. So they'll have low testosterone and high DHT.
Wow.
And we'll get into more details there again, but that's really the sort of hormonal ratio or balance that we see in these patients. Very often they present with even some other signs of low testosterone, because that enzyme is frantically converting all of their available testosterone into that DHT, which results in hair loss.
I know we're going to get into this later, but I'm assuming hair loss is a symptom of low testosterone.
So in some ways, right? So a lot of patients that do have male pattern hair loss are having elevated DHT and low testosterone. In comparison, low testosterone can also cause the body to lose hair. So it's kind of a complex issue where testosterone is really at play. But we do see the majority of men that have male pattern hair loss also do have low testosterone. So it's an
Wow.
interesting sort of correlation there, but not a direct one, as of course in the body, nothing is easy or direct.
As we learn here in every single video,
Yes.
things are connected, but not straightforwardly
Right.
connected.
Right. Lots of relationships.
You just talk about genes. Are there any specific genes that contribute to male pattern baldness?
Yeah, so it's a great question. So we always have thought in the past through myth, through word of mouth, at least I always thought growing up that male pattern hair loss was directly related to your mother's
Yes.
father or something along
Yes.
those lines. And while that is a great sort of idea, and certainly your mother's father's genes are at play here, it's much more complicated than that. There's
Mm.
no sort of direct lineage that says your mother or father's ancestor is going to contribute more or less to whether or not your genes express for you to have male pattern hair loss. It's really going to be everybody's pieces in their genetic materials getting passed on to you. And there's not one specific area of the gene or one specific chromosome or any of those types of things that we can really pinpoint the cause for male pattern hair loss. It's all of it together. And so just because your mother's father was bald or
Right.
had a full head of hair doesn't necessarily mean you will either. So it's much more murky than that direct sort of line that some of us create through word of mouth or things we've heard before.
It's so funny. In school, they make it straightforward. If you have that specific gene, you're gonna have male pattern
Right.
baldness.
Right.
But if you don't, you're not gonna have it. It's
Yeah,
not
I
as
remember those. You remember the four
yes,
squares, and
yes,
then you'd put the
yes,
information there,
yes.
and
The
then
genes and you
yes,
cross and
25%, 50%. Maybe
yes,
I'm talking rambling here a little bit, but yeah. So
75, 50%, 25, 0%. Yeah,
yeah, and so in school we want to, learn sort of the basics, and
right.
a lot of genes are like that. Eye color, hair color, things like that can be sort of this is what it is, this is what's available to you. But a lot of these other issues or more complicated health concerns have multiple genes involved, right? In that particular instance, you're looking at your mom's genes and your dad's genes, and then you cross them. Whereas hair loss is much more complicated than that.
And I'm assuming hair loss, the cause for hair loss is not just genetic.
Well, right. So it is sort of a genetic expression, and it does really almost I would say
Okay.
99% of it is related to genes, and you could say hormones too, right? You could say it's maybe 45% genes, 45% hormones, 10% or plus ish other things, but really our genes are responsible for our hormones too. So it all kind of boils down to genetic material and what sort of that dictates for our future.
That makes
Great
sense.
question. Yeah, absolutely.
So is everyone equally sensitive to dihydrotestosterone
First of all, he said it, y'all. If he can say it, you can say it.
or DHT?
ADHD, yeah, that's a little bit less of a mouthful. So just as we were mentioning, genes are important and they are what dictate whether or not we're sensitive to DHT. So some patients out there can have an enormous amount of DHT.
Wow.
Dihydrotestosterone can be very high in their bloodstream and they have no response. Their hair remains intact, the hair follicle does not become sensitized to the DHT and result in male pattern hair loss. And others can have medium or lower amounts of DHT, but still see it cause hair loss. So we do know it's all about how sensitive the hair follicle is to the DHT, and that's all related to our genetics. And so, yeah, so
Jeez.
some people are not going to have any issues at all. And it's really interesting too as a provider because I can order a test to see how much DHT is in someone's
Uh,
blood. And so sometimes patients will say, oh, I'm concerned if I'm at risk for hair loss. What's my DHT? Is it contributing? And sometimes it comes back low. And that tells me, okay, so this is for sure not related to, male pattern hair loss. And then other patients who are, I'm saying, hey, is that a concern for you? No, I've never seen a receding hairline. And we check their DHT and it's through the roof. And they're like, no, I mean,
wow.
it's not causing an issue for me. So it's interesting to see not only from what the research tells us and the books tell us, but what I see clinically matches up really well. So it's a nice kind of to know that we're not just reading things out
Right.
of a book. I can actually get to see those results in real
In,
time.
in, in practical
Yeah,
terms.
exactly.
Next time I get my labs done, I'm gonna ask my doctor to check my DHT values.
Absolutely. We can do that.
Yeah. So we talk about hair loss and hormone imbalance. What is exactly this hormone imbalance?
Right. So we know DHT, dihydrotestosterone, is the hormone responsible for hair loss. And we also know in the majority of patients that present with this concern, they have low testosterone. And so what clinical evidence has shown is if we try to improve this imbalance of a low testosterone and a high DHT, bringing their DHT lower and their testosterone higher, typically men not only see a immediate stop in their hair loss, they often will
Oh,
see new hair regrow as well. And so it not only, inhibits the progression of hair loss, but can help them to regrow some of the hair that's been lost and allow them to maintain their hair throughout the rest of their life. And so we know hormones, again, not only are important to target and reduce the symptoms of male pattern hair loss, but also to, recheck them and ensure the testosterone is able to reach its sort of optimal level so that we can keep that hair growing and prevent it from thinning as we age. So again, there's that hormonal imbalance. It's testosterone being low, DHT being high, and needing to sort of switch those so that our hair can maintain its vitality and we can maintain our vitality.
great news.
Yeah, it's possible
It's
to get
possible.
to that level through medical intervention. And of course, we'll get into those details soon. But yeah, addressing that hormone imbalance is going to make a huge deal.
All science.
Oh, science.
Can always count on science.
Well, usually we're
Not
working on it.
always. Most of the time.
Some of the time, ish.
So a couple of times in the past, I thought I was suffering from hair loss and I couldn't tell if I was actually losing hair or if it was just in my head.
Right.
How can you recognize the signs of hair loss?
Well, first, you're not alone. I've done this many a times before I met you, while have living with you, even, still on a day-to-day basis. I like to look in the mirror and check to see if there's any, recession or change of my hairline. And it can be difficult because some of us have very thin hair, some of us have very thick hair. Some of us lose a ton of hair when they shower, like myself. I lose between 100 and 200 strands
Wow.
a day, which is a lot. Usually the average is actually about 100 hairs can be lost per day, and you can still be considered to be healthy and not losing your hair. But for those of us who have thicker hair, we expect to see more. And so
Right.
I totally understand the stress and anxiety around hair loss, but the main thing you want to look for is the recession of your hairline. So what I always tell patients is try to take a picture of the front of your scalp, even measure, you can measure your forehead because that's going to
Wow.
tell you if it's changing that you're
Receding or
right.
not.
And the earlier you're able to identify that you're losing your hair, the faster you're going to be able to find treatment
Right.
and prevent it from getting worse and maybe even regrow some of that hair that you lost. So it's always good to check yourself in the mirror. Again, if you're not sure, literally measure it. I've even had some patients send pictures where they've drawn a line around
Wow.
their
Wow.
hairline and then a few days later have gone to check it again. Like they've literally left a mark there because it is traumatizing, right? A lot of us see hair loss as a sign of aging, as a sign of losing our vitality. And it really isn't that, you're still healthy. It's not making major health, concerns for you if you're losing your hair. In a male pattern hair loss sort of progression, of course, if you're losing your hair rapidly and you don't really fit into this mold, you do want to talk to a medical doctor. There could be something else going on. But yeah, just taking a look, keeping a close eye on how your hair is moving, from day to day. And if you're not sure, talk to a doctor. They can help you identify some major clues. Some people maybe won't be losing their hair as a recession of their hairline, which would be unusual to see it just happening at the crown of the head, so like
Mm-hmm.
thinning of the scalp at the sort of peak there. That is less common. Typically, with male pattern hair loss, you're always going to see some sort of recession, especially like near the temple
Yeah.
area or on the sides of the scalp.
Yeah,
So
that's where I thought I was losing hair. I was like, oh, this is receding.
yeah.
But it wasn't.
Yeah, and that's what I thought previously as well. So you're not alone. And a lot of my patients come to me thinking, maybe this is hair loss. I'm
Yeah.
like, you're good. We can do some lab studies to verify, and usually they're fine. But it is, a frantic and
Yeah.
emotional experience if, especially the first time you think, I'm losing my hair.
But because, like you said, right, as soon as you see signs of hair loss, you want to fix it right away. You want to start treatment. You want to start something quick before you're losing
continues.
Yeah.
Right. Absolutely. And yeah, that's the important thing too. A lot of times it does sort of trigger that need to do something about it
Right.
right away, which is great because then people start to look for information. Hopefully, if they found this video, this can be some way to support them. But there are, like we mentioned, many ways to treat this issue and to completely reverse it, which we'll get them to very soon. But yeah, just taking a look, measuring, monitoring, take pictures are super helpful. And if you see a progression, talk to a doctor.
Measure and monitor your hair. And if you're losing hair, talk to your doctor.
Thanks for the recap.
So for those out there who are not sure what a receding hairline looks like, what they should be looking for.
Right. So if you're measuring and you're not sure, or you're looking for something specific, typically a receding hairline again is going to start so on the sides of the head, and they're sort of going to start to recede upward, and so you may get a widow's peak, which is basically like a almost like a triangle forming at the front of your scalp. And then there's like a classic, what they call an M shape. So you'll have sort of the peak here of the M in the middle, and then it'll sort of come back as it digs deep into your temples and then sort of forward. So you'll see almost like an indentation in your temple area. But some patients don't sort of have that. It can always also be just the whole hairline moving backwards. So, but that M shape is really classic for male pattern hair loss. But those are the things to be aware of if you're noticing those changes.
Are there any bald spots that may arise from male pattern hair loss?
Right. So receding hairlines are not going to result in a bald spot. That's just going to be the hair moving sort of backwards. Where we see a bald spot typically present most commonly is going to be what we call the crown of the head, which I've been referring to as kind of like this sort of peak area in a circle. Oftentimes it will begin as thinning, and then it can eventually get to that balding area and start to spread. If you're seeing bald spots that are occurring other places than that crown, or maybe they're small, very well defined, if the hair is coming very quickly and it appears bald like within a week or shorter, that's something different. That's something to talk to a doctor about. Usually not something major, but everyone's a little bit different. So talk to your doctor, see what could be causing that issue. But usually they're not very small. They're quite large, so around the whole crown, and it's going to start with thinning and progress. That's typical of male pattern hair loss. But again, if you're seeing like a bald spot that appeared overnight, that's maybe about the size of a coin or a little bit larger, maybe on the side of your head front, that's something different. So definitely something to be aware of, and what would be classic for a balding spot in male pattern hair loss.
What could that be, for example?
Good question. So there are some autoimmune conditions that can result from stress or some other medical issue that can cause sort of a round, very concrete appearing bald spot. And typically those actually resolve on their own, or they can improve through your doctor injecting it with corticosteroids to reduce the inflammation there. But again, I don't want to get too far into that because there's so many different causes that if you do have bald spots that don't appear like male pattern hair loss, or you're not sure, you should always talk to a medical professional or your own doctor. These are, again, just general sort of ideas of what to look out for if you're concerned about male pattern hair loss.
I had a few times a bald spot in my beard,
Yeah.
and we had to inject the
Kenalog, the
Kenalog.
corticosteroids. So yeah, so that is very similar. You can actually have those bald spots appear all over the place. Alopecia areata is what it's called. They can happen in your beard. It's actually very common in facial hair as well as your scalp. Can be triggered from really anything from stress, autoimmune concerns, random.
Could be anything.
Could be anything. The main reason to be concerned is to get it looked at, know, and properly diagnosed, and then it's sort of reassuring after the fact you've heard alopecia areata, because typically it's going to improve pretty quickly.
Yeah, one or two injections was all it took to fix it.
Yeah.
What is age-related hair loss, and how is it different from male pattern baldness?
Great question. So age-related hair loss is also known as senescent alopecia, and it's considered normal. And the good thing about this normal version of hair loss is it's in general going to happen as we are aging, typically beyond 50s, 60s, 70s. And it's a slow process, and it's really just the thinning of our hair over time. So you don't usually see a dramatic recession in your hairline or bald spots appearing. It's just a general thinning. And so in general, it doesn't cause too many issues or concerns. There's really no treatment for it. It's just as we age, those hair follicles get aged as well.
Right.
And again, it doesn't typically result in something dramatic that you would see in a change. And of course, that can vary. There's genetics that play there too. Some people, as they age, it can be more progressive. If you already have thin hair, it's going to obviously look more substantial than if you have thick hair. But in general, completely normal and doesn't typically cause too much issues for people.
So now we talk about the causes. Let's talk about prevention
Yeah, and treatments.
and treatments. Are there any ways to prevent male pattern hair loss?
Yeah, so there are many different things you can do to both prevent and treat male pattern hair loss. So the most important thing is to have it identified as early as possible. Again, time is not our friend when it comes to treating hair loss. The longer you wait, the more unlikely that that hair that was lost will not regrow, and more likely that it's going to progress and get worse. But in general, the best way to initially start is to have the observation reported to a doctor, someone who can give you the medical diagnosis that you have male pattern hair loss. And then you get to consider all the treatment options. And there are quite a few. So, first things first, you always want to consider lifestyle factors. So, reducing stress, eating a well balanced, highly nutrient dense meal regularly, 3+ times a day, exercising, drinking plenty of water. All these things are really the basics and fundamental to normal and healthy hair growth. But when it comes to trying to really identify and treat male pattern hair loss and affect that enzyme and the DHT, the medications that are available would be topical options, so you apply it, oral options, so you ingest it, or surgical options, so you have surgery.
Right.
So, looking at the topical options, which you can actually purchase over the counter, the most common one that people know is called Rogaine. It's the brand name, or Minoxidil,
Mm-hmm.
typically 5%. So, it's a type of solution that you actually apply to the scalp. And there are very specific instructions on how to use it. Sometimes the bottle says don't use on your hairline. Many times physicians will recommend still using it there, but you want to talk to your doctor. The thing about how Rogaine or Minoxidil works is it's actually what we call a potassium channel blocker. And so it's very unusual. We don't really have many medications out there like it, and we're not even exactly sure how that impacts hair loss or results in it working, but we do know
Right.
that it works. And so
Yeah.
oftentimes this is a major part of a treatment plan. Sometimes you'll combine it with the oral option, which is most commonly referred to as
Right.
finasteride. It is the FDA approved medication to treat male pattern hair loss. It blocks the conversion of testosterone into dihydrotestosterone by blocking that enzyme, alpha 5 reductase. And so it's an extremely helpful, extremely effective medication, not only to prevent hair loss if you're seeing signs of it, or maybe you have a genetic family history, but to treat and maybe even regrow some of the lost hair from the diagnosis of male pattern hair loss. We know, again, it's probably the most effective. There are some brothers or sisters to the medication that you can consider, but they're not FDA approved specifically for hair loss. So that's something to talk about with your doctor. And then, of course, the surgical options. So you may have seen your favorite influencer or celebrity go on a trip to Europe to have hair plugs put in or some sort of
Yes.
hair transplantation. And the dramatic changes of how this procedure has evolved over time is really incredible because it has become so non-invasive, same-day procedure, in and
Wow.
out, pain-free in many places. So very, very successful. And a lot of times too, those patients who have had surgery will be put on finasteride. A very powerful combination would be surgical enhancement as well as finasteride, or finasteride and minoxidil. Of course, you always want to be considerate of your medical history and talk to a doctor before taking on any of these concerns. I know many patients out there will probably be asking, well, what are the side effects from finasteride? And
Yeah.
the majority of patients have none. They typically are going to tolerate finasteride really well. The problem is about 4 to 5% will report some form of side effects. And
Wow.
typically it's due to the fact that their dihydrotestosterone has plummeted. And we do know DHT, or dihydrotestosterone, is important with a lot of other things than just losing our hair. It's actually one of the most important hormones that help us evolve through puberty. It helps us to grow our genitalia as we're
Wow.
maturing. It grows body hair for us. It helps to deepen our voice. So a lot of those masculine characteristics are actually due to DHT. The
Wow.
problem is it doesn't really have a purpose beyond that. But
Mm.
it does also impact our sexual function. So if you plummet your DHT, and a lot of these patients don't have any testosterone, they have low testosterone as well. They were getting the primary push from their sex drive from DHT, and now we prescribe medication that blocks it. They'll present with things like erectile dysfunction, a
Wow.
decrease in their libido. Some patients even report depression because we know our hormones are important there. And that's why it's also really important for patients that are beginning this journey to do a further investigation on their testosterone values. If you're seeing male pattern hair loss, it's a great time to also mention to your doctor, hey, I want to see if I have low testosterone as well. Let's see if this is a issue that could also be at play. Because if you start finasteride and you deplete your DHT, you're going to likely see some problems if you also have low testosterone. So again, something that is important to discuss with your doctor. And what's really interesting too is new clinical data is showing that patients that are on both testosterone replacement therapy and finasteride to block the conversion of testosterone into DHT, again, bringing that testosterone high, putting that DHT low, have the most success. So they're going to see increases in the lost hair sort of coming back. You're going to see some new growth. We're going to prevent that lost hair from progressing. And we're also going to see some of their low testosterone symptoms, which they may not even know they had, start to improve. So an increase in their libido, feeling stronger, increase in lean muscle mass. So all those things end up being a really positive outlook for patients that are concerned with this issue, and feeling as though they don't have treatment options. There's plenty of them and a lot of things that can be thought about to find what's best for them. So long-winded answer there, but
No, it's fascinating how many procedures and treatments are available. You can do
yeah,
minoxidil, you can do finasteride, you can do the surgery, you can
yeah,
do all combined.
yeah.
It's incredible.
Yeah, and there is some other things that are not FDA approved yet, like an example being ketoconazole, which is an
Hmm.
antifungal shampoo. Oftentimes it's used to treat dandruff, but we do know that ketoconazole also has some anti-DHT properties. So oftentimes you'll see that prescribed to patients as well that just want to try and do everything they can to prevent hair loss. But really, the clinical evidence has shown finasteride and testosterone replacement therapy, specifically for patients with low testosterone, seem to do the best and have the best outlook or progress with their treatment.
Crazy because I assume that all those treatments options, they are something recent, something modern,
Right.
because I'm gonna say 20 years ago, I don't remember having all these options available for
Yeah.
someone who is suffering from male pattern baldness.
Yeah, it's so funny too. My own personal journey with male pattern hair loss started maybe 12 or 13 years ago. My first relationship,
Hmm.
actually, the person I was with was on this medication. The brand name was called Propecia, which was finasteride specifically for male pattern hair loss. I saw them undergo surgical, hair transplant as
Wow.
well. And I never thought that it would be a continued theme in my life at
Yeah.
that time. But hey, and that wasn't even, I think that was even longer than that. I forget how old I am. I think that was like 14 years ago.
Wow. Look at us now talking about
And here I am doing a lecture on hair loss. Who would have thought?
teaching people and
Yeah.
providing education
Yeah, and I
to,
think I think too male related health concerns for those of us out there who identify as male are always interesting. It's
yeah.
always, a curiosity for us as we age to figure out what these things are happening to us, why it's happening to our friend and not us, why it's happening to us and not our friend.
And there's always something new too, a new
Yeah.
treatment, a new medicine, or a new
Yeah.
solution. I think is great to talk about those things because that's how we learn.
That's how we learn.
So to summarize this incredible discussion with you,
Incredible.
what are the high level takeaways that we can take from this topic?
Yeah, so I think the most important things to consider are identifying what male pattern hair loss is for you. So if you're concerned that this could be an issue, start to track your progress, take photos. If you're high level concerned, talk to a doctor as soon as possible because, as we discussed, these treatment options are the most beneficial when taken as soon as you notice changes. If you have a genetic or family history of hair loss, maybe your brother has it, your two uncles and dad have
Yeah.
it. Maybe it's just something you keep seeing or concerned about, or maybe you're just really, really concerned because you love your hair. Talk to your doctor about the potential of just taking the medication to prevent any sign of that happening to you. It's very common that patients present saying, "Hey, I just want to make sure that this doesn't happen to me. I've seen it in my father or my grandfather." You can also talk to your doctor about getting tested for DHT levels. This is not the most effective way to target and treat hair loss, though. You can have high DHT levels and have no sign of hair loss. You can have low DHT levels and have lots of hair loss. So that's something just to be considered about, of course. Also, knowing that medications do come with potential side effects. So
Right.
make sure your doctor is well versed in providing you the information on those. Something else to touch on in regards to side effects, if you see signs of side effects from finasteride like erectile dysfunction, a change in your sex drive, you need to consider stopping the medicine right away. Talk to your doctor first, but the reason is clinical evidence has shown if you continue to stay on the medicine with these side effects, they can worsen.
Wow.
Some patients will see them improve, but if it's been 2 or 4 weeks and they continue, you should talk to your doctor right away because you don't want those things to exacerbate or to worsen, especially erectile dysfunction. That's not something you want to live with the rest of your life from a medicine that you may discontinue. And then just knowing that you're not alone. It's very common. It's nothing to be concerned about. If you're not concerned, if you are just wanting information, but you don't want to do anything about it, that's perfectly fine. You're not going to see subsequent health issues from male pattern hair loss. Some people look great bald. I personally would not because I have a giant head.
No, I disagree.
Thanks.
I think
But
you look gray ball. It will be a look.
you think?
Yeah,
Who knows?
you
Maybe
could
I
try
will one try
sometime.
one day. I don't like my hair with short. I don't like short hair for me. But again, that's a whole nother topic. But yeah, in general, these are the high level things I would want people to take away. Um, and yeah, but I think there's a few myths we should discuss
Oh,
too.
there's always a myth that we discuss here. Don't worry. There's always place for myths.
There's always a place for some misconceptions.
I think this is myth number one in the history of myths. And this is my favorite one because I
Wow.
hear that a lot throughout my childhood. When I was a teenager, I always heard that.
Okay.
Wearing hats or helmets causes male pattern baldness.
So I am so glad this is brought up today because of the fact that I wear a hat all the time. And some people have commented, why do you always wear a hat? And what's the deal with the hat? The reason is I have extremely curly hair and I like my hair longer, and it is very difficult to tame. But it's very easy to put a cap on and not have to worry about it. So that's the reason why I wear a hat all the time. But there is no clinical evidence to show that male pattern hair loss is caused by wearing caps, hats, helmets. They are great. Hats are a great way to reduce UV damage from the sun. I highly recommend you always wear a hat outside. For those of us with crazy hair, it helps. In regards to what hats can do with your hair, if you're wearing a cap or a hat or some sort of helmets that is too tight on your scalp, especially if it's pulling at your hair, that is going to cause hair loss, but not male pattern hair loss. It causes hair loss from the tension, right?
Like a tight ponytail.
Yeah, exactly. Just like the ponytail effect. So ponytail effect means you are pulling too tight on your hair follicles, and of course they're going to fall out. They'll grow back, but over time, just if you were to like tweeze your eyebrows over and over again and pull
Right.
the hairs out, they stop growing. The hair bed, the follicle gets inflamed at the base and can stop growing completely. So if you're wearing hats that are too tight, or if you're wearing hats that you never wash, because again, if sweat is accumulating in a cap or a helmet and you're putting it on, that's going to irritate the base of your hair follicle and result in hair loss. But again, no correlation between wearing hats and male pattern hair loss. Keep wearing the hat, just make sure it's a clean one.
Keep wearing the hat, clean your hat.
Yeah, that's all you got to do.
Is it true that male pattern baldness only affects older men?
So unfortunately, this is not true. I think it would be a lot easier for a lot of us to sort of understand and maybe even accept hair loss if it was happening to us in our 80s, 90s, because we have other things to worry about. But maybe some patients still want their hair. I would too. But unfortunately, male pattern hair loss can happen anytime. We've seen it in teens, we've seen it in people in their 20s, 30s, 40s, and beyond. And again, it is a genetic hormone related issue. In general, we typically, again, will see it around the age 50 be sort of at its peak. But I have many patients that have experienced hair loss in their 20s, 30s, and 40s. And so if you're seeing that, you are not alone. This is considered a normal progression of the medical condition. And again, talking to a doctor as soon as possible to get on an effective treatment strategy is what I would recommend, but you don't have to. It can be normal for you. And if you don't mind losing some hair, it's just hair.
It's just hair.
Yeah.
You can grow back again. There are options.
Well, if you have male pattern hair loss, it's not going to grow back again unless you do treatment. But you could wear hats. You could just wear a lot of sunblock on your scalp. I'm not here to tell anyone that losing their hair is, a horrible response to aging or having this medical condition. If you like your hair, do something about it. If you don't mind losing it, just keep moving on.
My dad, he started losing his hair when he was 18. By the time he was 25, he already lost all his hair.
Wow.
Since growing up, I always had this fear that I was going to become bald by the
Yeah.
time I was the same age. This is one of the reasons why I was so afraid of losing hair, because I always had that in my head. I don't want to be bald at such a young age.
Yeah. And again, it's everyone in their own personal journey. I would feel the same. But if it happens to you and you're okay with it, no stress.
Or seek treatment.
Or seek treatment.
It's reversible.
It's reversible.
Is it true that hair loss is caused by frequent shampooing or hairstyling?
Yeah, so that is a really good question. There is no clinical evidence to show that styling your hair routinely or over shampooing or under shampooing will cause male pattern hair loss. That is very specific, again, hormone related, genetic related. If you are styling your hair where you're putting too much tension on your scalp
Right.
and the base, like we talked about, that's certainly going to result in hair loss, not male pattern hair loss, just hair loss in general. And then if you don't shampoo or cleanse your hair enough, that again can irritate the follicles and result in hair loss. There's a lot of data and a lot of confusion about how much is too much in regards to washing your hair. I'm sure I'm going to get some flack for this, but I wash my hair a lot. I condition my hair a lot. Some people say you shouldn't. There's no data, though, that washing it every day or multiple times a day will result in hair loss. The only thing we do know is that if it gets too dirty at the base of those follicles, they can get inflamed and fall out. So making sure that you are at least, cleaning your hair regularly is going to be what I recommend, but you're not going to overwash or over condition, resulting in hair loss typically.
Growing up, I used to hear that if you wash your hair right before bed and go to bed and
Yeah.
go to sleep,
Yeah.
you will lose your hair.
I've heard that too.
Is it true?
No evidence to that. There's no evidence that you need to use a specific type of cotton or polyester or satin fabric. And that actually is varying dependent on your hair texture. There are some clinical studies that showed that satin is good for more coarse or shorter hair. There's probably many talks on that. That's not my expertise, but in general, you're not going to over shampoo your hair away.
So keep styling your hair. That's
Yeah.
okay.
But if you notice changes happen from your products that you're using, that's a different story. There
Right.
could be some sort of allergy there or irritation that you specifically individually are experiencing. So always talk to your doctor. This is a general topic discussion, answering questions generally. We don't always fall into general. Sometimes we are outliers ourselves. So again, you want to make sure that your individual experience is understood by a medical professional, not just a YouTube video.
Right.
We do our best though.
And if you change your product, monitor your hair.
Yeah.
See if there's any changes,
For sure.
if your hair responding well to it.
Yeah, that's actually a great point. So if you change your product and you notice your hair is falling out, that's not normal. That's
Something is wrong with
yeah.
the product that you're using.
right.
Last but not least,
Mhm.
high testosterone causes male pattern baldness.
That's a great question, and one that I talk about a lot because I work in hormone replacement. I treat patients with testosterone replacement therapy. My goal is to get their testosterone optimized. And so patients will often say, I heard having high testosterone puts me at risk for hair loss. Does TRT cause hair loss? And there is no clinical correlation that testosterone itself will cause male pattern hair loss. In fact, having optimal testosterone values can help to ensure your hair continues to grow. And what we do know is that if that testosterone is being converted into DHT, which can happen while you're on TRT if you're already seeing signs of hair loss, that we want to make sure we put you on an alpha 5 reductase inhibitor, those finasteride type medications to block that conversion so your testosterone remains high and your DHT is low. So testosterone itself in no way is going to cause male pattern hair loss. It's DHT, and that's the culprit. Sometimes patients will come to me saying, I already have concerns for hair loss. I'm seeing this change. So initially we'll put them on finasteride and then we'll check their testosterone values. If they're low, we'll put them on TRT and they'll come back in 2 or 3 months and say, oh my gosh, I'm already seeing improvement.
Wow.
That's not everyone though, just to throw that in there. Finasteride can take 6 to 12 months before you see any improvement, and that is normal. I typically see patients have more improvement when they're on the combination of TRT and finasteride. But just something to be considered about. If that's your journey, patients will sometimes say, I'm only on finasteride. It's been 3 months. I haven't seen anything. That's normal. Give it some more time as long as you're tolerating it well and not having any side effects.
It's like everything in life. It takes time, patience.
Yeah.
And then you see the results.
Exactly. And if you're concerned you have low testosterone, or that could be a cause for your male pattern hair loss, or in general have issues related to hormones, you can always reach out to us here at hendrxhealth. I'll put a link in the description of this video where we can screen you for low testosterone and see if that could be a culprit resulting in some of potential symptoms that you may experience. But yeah, we are done with hair loss. That was a really nice overview, I think. Thank you for the great questions.
Thank you for the great answers. Again, I learned a lot about hormones, about our biology, genetic response to
Things,
THT, and
THT and
there's
stuff.
so much we learn here in this channel.
I'm glad. Hopefully y'all are learning with us, but if you have any questions or concerns, please do leave them in the comments below. If you haven't already, please subscribe so you get alerted when we make new videos.
Comment,
Like,
suggestions.
this, that, bam, wham. Thank you, ma'am. Hopefully we get to see you at a next video soon. But until then, have a great rest of your day or evening, and we will be talking with you soon.
Thanks for listening, and see you next time. Are there any specific genes that contribute to male pattern blah 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 blah? Let's show the audience. Every time I say blah 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 blah, that means male pattern burners.